Nursing is an art, and if it is to be made an art, it requires as exclusive as devotion, as hard as preparation, as any painter's or sculptor's work. For what is having to do with dead canvas or cold marble, compared with having to do with the living body, the temple of God's Spirit? It is one of the fine arts. I had almost said, the finest of the fine arts. Nurses work to promote health, prevent disease, and help patients cope with illness. They are the advocates and health educators for patients, families, and communities. Nurses work in an environment that is constantly changing to provide the best possible care for patients. It is often said that physicians cure and nurses care. Nursing practice is the actual provision of nursing care. The Joint Commission International works to improve patient safety and quality of healthcare in the international community by offering education, publications, advisory services to international accreditation and certification. In more than 100 countries, JCI partners with hospitals, clinics, academia, medical centers, health systems and agencies, government ministries, academics, and international advocates to promote rigorous standards of care and to provide solutions for achieving peak performance. The JCI published its latest International Patient Safety Goals in its 4th edition of the JCI Standards for Hospitals. The purpose of IPSG is to promote improvement in patient safety. The goals highlight problematic areas in healthcare and describe evidence and expert-based consensus solutions to these problems.
IPSG number 1. Patient identification. Patients identified by 2 identifiers: patient's forenames and hospital identification number. Patients must and should be identified before medication administration, before transfusion of blood or blood products, before taking blood samples and other specimens for clinical testing, before providing treatments and procedures, and prior to any transport outside the ward or unit. IPSG number 2. Ensure effective communication. The complete verbal and telephone order or test results are written down by the receiver of the order or test results. Verbal orders will only be accepted in emergency situations like life-threatening events. The doctor must be physically present. Verbal order will be written by the person receiving the order, together with the witness nurse who will repeat back the complete order to the ordering doctor for verification. It must be documented in the doctor's order sheet that indicates the time and date of the order, the name of the doctor, and the complete details of the order. It must be signed within 2 hours by the ordering doctor or immediately after he finished a procedure or operation. Telephone orders will be accepted in situations that require actions that will facilitate care of the patient. The ordering doctor should identify him or herself, specifies the patient's name, ID number, and communicates the order. The receiving nurse will read back the order for verification with the presence of the witnessing nurse. It must be documented in doctor's order sheet indicating the time and date of the order, the name of the doctor, and the complete details of the order, including the name and title of the receiver and the witnessing nurse with their employee numbers. Exceptions of telephone orders are multiple drug dosage including antibiotics, initial ventilator settings, chemotherapy administration, home against medical advice order, code status, and high alert medications. Critical results are laboratory results beyond the normal variation with a high probability of a significant increase in morbidity or mortality in the foreseeable future and requires rapid communication of results for determination of intervention. Upon obtaining a critical result, the laboratory staff will immediately notify the doctor via phone. If the doctor cannot be reached immediately after 3 attempted calls over the next 15 minutes, the results will be reported to the charge nurse. The reporter should identify him or herself to the one receiving the result. The reason of the call should be clearly stated and the following information must be specified: patient ID number, patient name, name of the test, date and time investigation requested, and the findings of the result. The receiver will write the result in patient's chart, do the readback technique, and document the date and time of the call and the name and job of the reporter. IPSG number 3. Safety of high alert medications. High alert medications refer to medication that have an increased risk of causing significant harm to patient when used in error, or medications that carry a higher risk for adverse outcomes, as well as look-alike or sound-alike medication. Examples of high alert medications can be found in all the medication rooms in each department. High alert medications are identified by specialty labels and are properly stored in separate container or cabinet and continuously locked. No abbreviations should be used in high alert medications. Nurses should be full-oriented in identifying look-alike or sound-alike medications and the use of Tolman or Shortman lettering. IPSG number 4. Ensure correct surgery, site, and patient surgery. There are protocols to be done prior to surgery or invasive procedures. Check the doctor's order in order to verify the procedure. Patient's identification, nursing database, or patient's history or physical examination. Consent must be obtained. Anesthesia clearance. Blood transfusion consent, which applies to all patients going for surgery. Preoperative checklist is to be completed prior to surgery. Nurses and surgeons must know the timeout procedure, which is to be done outside the operating room and held immediately before the start of the procedure. It should be found in patient's file. Correct surgical site is marked by arrow and to be done by the surgeon. It is properly documented in patient's file. IPSG number 5. Prevent healthcare-related infections. Nurses identified the 5 moments of hand hygiene, which are the following: before touching the patient, before doing an aseptic technique, after body fluid exposure, after touching a patient, after touching patient's surroundings. Nurses must also follow and demonstrate the correct steps in hand hygiene and hand rubbing. We should be aware of the isolation precautions and proper use of personal protective equipment, including the proper donning and removing of PPE. Proper donning starts with gown, mask, goggles, and gloves. Removing of PPE starts with gloves, goggles, gown, and mask. IPSG number 6. Prevent patient from fall. All clinical staff is responsible for ensuring that all patients with whom they have a face-to-face contact are assessed for the risk of falling using the agreed ratified form. Morse Fall Scale Variable is a tool used during assessment which includes the following criteria: history of falling, secondary diagnosis, ambulatory aid, IV access, and gait. These are the 6 international patient safety goals published by JCI.
In promoting quality and patient safety, the nurses are exceptionally valuable members of the healthcare providers and in a unique position to care for patients as they are working on the front lines of care, saving lives, promoting health, and contributing to reducing costs. We regard nurses as the central pillar of the healthcare establishment. Nurses are the most suitable healthcare professionals to implement principles of quality and patient safety at the bedside. They are critical to the delivery of high-quality, efficient care, and as members of the interdisciplinary teams, they are cooperative, dynamic, and dependable in applying healthcare quality and patient safety standards in the workplace. This year's National Nursing Week is an opportunity to bring attention to the profession's role in optimizing our health system. Our theme, Nursing, a Leading Force for Change, shines a spotlight on the powerful role that nurses can play in changing healthcare for the better. In behalf of the team, we would like to extend our gratitude in taking time to watch our slideshow presentation. Thank you very much. Happy Nurses Day!